Thank you very much.
Dr. Emad, now last time we were on stage, you did a deep dive into type 2 diabetes, but today the subject matter is...
Well, we're looking at the power of lifestyle medicine, how to live well. It's a much more general talk, and I hope it builds on the excellent talks we've just heard from the last two speakers without too much overlap either, I hope.
So without further ado, Dr. Emad George, the stage is yours.
Thank you very much indeed. Thank you very much for coming along. Appreciate it. I've got three real aims for this short session. The first is to tell you something about lifestyle medicine and perhaps a little about myself and how I've arrived talking on this stage, which is something I'm wondering right now. The second thing is to give you a chance to reflect on your personal health. And the third thing is, rather like Dr. Rossi trying to persuade each one of you to make one change towards a gut-friendly diet, to perhaps get each of you to think about one thing that you could change in your life that will impact upon your health. But to start with, you'll have noticed on my slide I have those familiar faces from customer satisfaction. So let's just take a very, very brief health check. How many of you, if you think your health is excellent or good right now, put your hand up. Do I see any? Well, actually, we know you can do the things, so that's fine. So one or two. How many of you would say you're average? Yeah, that's the vast majority, and I think that's reasonable. Don't overthink it. I'm not going to ask for a show of hands on poor or bad, or that would be very, very unfair of me. But I think it just shows that we can all probably do with something to do with improving our health. So I put up on screen now for you a vision for healthcare, and I believe in this. But I want to tell you a little bit about why I believe in this. A couple of years ago, I turned 59, and at that point, I realised I probably needed to do something about my health. I was carrying more weight, I wasn't exercising, my job was stressful, probably very familiar to a lot of you, although looking around the audience, the 59 bit might not be familiar to some of you. But I decided I had to do something about it. My wife is a doctor, she worked closely with me, and we actually, ironically, given we heard Dr. Rossi earlier, went down a gut microbiome-friendly diet, put more exercise in, but I also began reflecting professionally and realising that I'd been a doctor since 1988, I'd been a consultant since 1998, and I'd seen a huge rise in our ability to diagnose disease and treat disease, but that didn't feel enough. And I came across this, which is really a vision that looks at the whole person rather than just looking at a disease. It looks at root cause. It's evidence-based, which is terribly important, I think, to me. And I particularly like the fact that in this healthcare model, it wanted physicians who not only certified in lifestyle medicine, because that was the specialty that this was coming from, and this came from the American College of Lifestyle Medicine that was founded in 2004, but it expected you to live it yourself. And I think that's really important for professional authenticity. So what is lifestyle medicine? Well, you've heard in the last two talks about some lifestyle interventions. And lifestyle medicine believes in using therapeutic lifestyle interventions as the primary treatment for chronic conditions. One being diabetes, which I've worked in for a number of years, but also obesity, and also heart disease and many others. I've already outlined the fact that they want certified practitioners who practice what they preach, and the comprehensive approach is terribly important. It's evidence-based, whole body, intensive. I would stress that it does not exclude the use of traditional care. So lifestyle physicians also use medications, also use surgery, also refer to other specialties. So you're not denying patients any of the other great advances that we've seen in medicine, certainly over my professional career. Now, there are 6 core pillars, and some of these will be a little familiar to you from the two talks that you've just heard. The first is, well, we use the word diet, but I must admit I'm getting away from using the word diet. It always sounds like punishment and restriction to me. So I prefer to talk about eating patterns. And it talks about an eating pattern that is based on whole grain and predominantly plant-based, which you remember were two of the things that Dr. Rossi described as being part of gut-based health. Good physical activity, we've just heard an excellent talk about from Matt Roberts. He also touched upon good sleep, which I will come back to. Stress management, I'm not proposing to say too much about stress other than to say we all have it, we all have to find ways of living with it, and exercise obviously is a good way of stress reduction, but so too are things like time management, breathing techniques. There are lots and lots of different ways to do it, and I would explore what works for you. Now, avoiding and restricting substances such as tobacco and alcohol is pretty obvious, but I must admit, on a personal note, I would add ultra-processed food to those substances. I think there's enormous damage being wreaked by them, which Matt touched on, and I think I would certainly say we should all be thinking very carefully about what we're eating and what the effect of ultra-processed food has on us. And I also want to spend some time talking about the sixth pillar, which is positive social connections and positive outlook on life and the health benefits of that. Now, okay, so that's lifestyle medicine. That's what it does, but why is it relevant? Well, let's look at some figures. These are figures on screen are those for chronic disease in the UAE as it stands at the moment. Now, in my specialty of type 2 diabetes, just over 16% of all adults in this country have type 2 diabetes. Those are the ones we know about. There are probably about another 2/3 of cases that are undiagnosed at the moment. And that's actually an improvement on where we were a few years ago because public health initiatives have lowered this. Obesity is a huge risk factor, not only for type 2 diabetes, but for heart disease, certain types of cancers, lung diseases, and so on. And at the moment, throughout the UAE, more than 1 in 4 adults classify as obese. That's pretty sobering. And when you look at the spread from emirate to emirate, it's around 22%, just over 1 in 5 in Dubai, but it's rising to nearly 4 in 10 when you get to some of the other emirates such as Ajman and Fujairah. And we're seeing this globally. This isn't just the UAE. If you look around the GCC region, you will see higher type 2 diabetes rates than this. If you look at the US, it's around 10 to 11%. And you're seeing this as a rise. Obesity is everywhere now. It's endemic. And it's a significant health problem for all health populations and all health economies. Which is why you'll also notice I've put some figures up about obesity and its impact on GDP. If you believe the World Obesity Federation, by 2035, 4.8% of the GDP of this country will be spent on the direct effects of obesity. Now that's $32 billion. That's a sobering thought. Less than 2 million will be on direct healthcare costs. The rest will be due to those suffering from obesity who can't go to work, those who are at work but unable to fulfill their work functions adequately, and very sadly, those who will die prematurely. So I would argue that we need something other than just disease-based treatments to make sure that we are trying to tackle this global crisis. Now, I mentioned 6 core pillars. What I'm going to do with the time allotted to me is look at sleep from an endocrine point of view, so slightly different to where Matt Roberts was coming from. But I do want to spend some time talking about social connectedness. And I also want to spend a little bit of time about what are our barriers to change and how practically we can try to overcome them. So, sleep. Well, as an endocrinologist, I first of all want to ask you, how many of you slept between 7 to 9 hours last night? Good quality sleep. You are very good people. Well done. And you're better than I was last night. My daughter persuaded me to stay up late watching a football match, so I would argue I was embracing my social connectedness pillar, but it probably wasn't doing anything for my sleep. So 7 to 9 hours is that sweet spot. What I know as an endocrinologist, and also as somebody who used to work at nights as a junior doctor, is that when you don't sleep properly, your hormones go wrong. Your cortisol goes up, your adrenaline goes up. Those things push your sugar up, make diabetes more likely, make heart disease more likely, increase your weight. In this world of Mounjaro and Wegovy, it's also worth noting that poor sleep increases your hormone ghrelin, which is your hunger hormone. And it reduces the hormone leptin, which is your appetite suppression hormone. So poor sleep does the exact opposite of these drugs. So I would argue as a physician, and I'm scope certified, so I do prescribe these drugs as part of our bariatric service. But I think taking a proper detailed sleep history from people, looking at when they go to bed, when they wake up, whether they suffer from insomnia, as 10% of adults do in the US, a really important thing to do. just giving a drug is not enough. But you'll also understand then that if your hunger goes up, your appetite suppression goes down, your cravings change. You tend to carb crave. If any of you have worked at night or done an all-nighter before exams, you'll know between 2 a.m. and 4 a.m., suddenly chocolate becomes highly desirable. Yep. Yeah, I can see nods in the audience. So we know that if you don't sleep well, you wake up tired. And if you're tired, how can you be expected to make good decisions about your health? How can you be persuaded to do the exercise program Matt was talking about? How can you be persuaded to make the food choices that Dr. Rossi was talking about? So sleep is essential. Now, Matt touched on some of the things that you can do. I've mentioned your target duration. When you get a bit older like me, 6 hours might just be enough, so I might just have got away with it last night, but I think probably not. Getting a good routine is key. And what I tell my patients to do is, first of all, work out what time during the week do you have to be up? Because that determines your wake time, and your wake time should be the same during the week and at the weekends wherever possible, or certainly not vary by more than an hour. Long lines at the weekend to catch up really don't do the job, I'm afraid. So let's say you've got to be up at 6. That would mean you need to go to bed probably and be asleep by 10 o'clock, which it doesn't fit in with most 21st century Western living. So, and that's assuming you fall to sleep straight away and you sleep well, but it means you've got to start thinking about sleep at about 9:30 and prepare yourself properly for sleep. So screens away, because the blue light blocks your melatonin production. It means thinking about maybe a warm bath, a shower, a hot drink, reading a book, doing the things that calm your mind. If you're an innate worrier, one of the things that I've been told helps, and I really ought to do it myself, is to write down all the things that you're worrying about on a piece of paper, put it to one side, go to bed realising you can't achieve anything in achieving those tasks while you're asleep. So regular routine is terribly important. Screen management's important. The bed environment is important. The bedroom is for sleeping. I'm not sure necessarily by yourself all the time, as Matt suggested, but it is for sleeping. And it should be somewhere that's at the right temperature. You have blackout curtains if at all possible, and try to remove as many mobile devices and distractions as you can from your bedroom. Now, it's normal to wake up at night. That is not unusual. And it doesn't mean that you can't be qualified as having good sleep if you've woken up at night. It's falling back to sleep quickly that's important. So one of the things you need to do when you wake up is avoid any bright lights. Don't go to the bathroom and switch your light on, because a brief bright light switches off your melatonin completely and your body thinks it's daytime. So what I do is keep a very cheap torch I got from a camping shop with a red light on it. I didn't buy it because it had a red light on it. It just happened to have a red light on it. But to save me from falling over in the dark and increasing my hip fracture risk, etc., I use the red light when I go to the bathroom at night. So simple things can help. I mean, I think Matt talked about alcohol and its effect on sleep. That's sensible. Good hydration, but at a sensible time, so you're not waking up in the middle of the night to pass. Well, all these things are simple and practical. Now, I think I've probably said enough about sleep, but we can come back to that in questions if need be. But I do want to spend a little bit of time on this, because this is something that I think we don't think about. This is the UAE Year of Community, and I want to prove to you, through a couple of pieces of evidence, why that is visionary and why it's important. Now, we all know that as human beings, we are connected. And we all know that when we go out with our friends, if our friends are unhappy, we feel unhappy. If our friends are in a good mood, we get into a good mood. But there is evidence for this, and evidence is really important. The Framingham study is a study that was carried out in New England, in the US, primarily to look at factors like blood pressure and cardiovascular disease. But what it meant was that you had a steady population that you could study. And one of the side projects that was run was to look at social networks in approximately 5,000 individuals over 20 years. And they found some interesting things. You might expect, as I said, if your friend is happy, you'll be happy. And indeed, they showed that if a direct friend of yours who lives within 1 mile or 1.6 kilometres of you was defined as happy, your chances of happiness increased by 25%. I think that's amazing. But what really surprised me was that there are 3 degrees of separation when it comes to this. And happiness depends not just on your friends, but on the happiness of your friends and the friends of your friends of your friends. Now that to me is staggering, but we see the same thing with obesity when we look at the data as well. So I think that there is an awful lot more to come about understanding human behavior and human interaction and the effect it has on our personal health. Emotions are contagious, but I think we need to look at this more. Now, the Harvard longitudinal study is the longest longitudinal study in the world. It started in 1938, looked at a group of Harvard graduates, including John F. Kennedy, and it's followed up generations since with studies year on year. And one of the things that the researchers looked at was, what is it that makes you live into your 80s well and happy? And they found that one of the key factors was, if back in your 50s, a decade I'm now past, if you had good quality relationships, that was the key. It was more important than your nutrition, more important than your exercise, more important than anything else. So the positivity of those relationships, the positivity of the relationships you have are really important. There's further evidence from the blue zones. How many of you have heard of the blue zones? Any hands? Yeah, one or two. So for those who don't know, they're the areas around the world, 5 areas identified as having the longest living people in the world, the most centenarians in populations. And they're quite diverse populations in different parts of the world. But one of the things that defines them is their social connectedness. It's people having a collective sense of purpose, a connection with family, and actually a connection or a reconnection with religion in some communities. So there seems to be an increasing evidence base that this kind of social connectedness, positive psychology, positive outlook can influence our health outcomes. And I think that's why a UAE Year of Community is important and relevant. So my next question, what are you going to do? You know, I'm the third speaker talking about changes we can make in life. What I would like to think is that each of you will take away one area you can focus on. You know, it could be nutrition, could be exercise, it could be spending more time with family and friends, but choose just the one thing that you need improving and make it specific. Just saying I'm going to improve my food intake is not really going to cut it. Maybe saying once a week I'll have a vegetarian meal, whereas at the moment I don't do that, might be more relevant. Or you might say, I'm going to walk for 30 minutes 3 times a week at a brisk pace, rather than I'm just going to increase my walking. And one of the things we do as lifestyle physicians is we prescribe things like this. We make sure that we sit down and negotiate with patients and prescribe these kind of things. Do commit to a timeline. When are you going to start with it? If you're saying when it's going to be 6 months' time, it's probably never going to happen. Ideally, it's going to happen in the next month to be effective. And I think importantly, you've got to think ahead and plan for obstacles, because change is difficult. We know that. And there are always obstacles to change. The kind of barriers that we come across, and these will be familiar to all of you. I mean, time. How many of us believe we don't have enough time to make changes? I think we do. I think we need to, and I think we need to prioritise our health. And I was pleased to hear previous speakers talk about health span as well as lifespan. Financial concerns can be an issue. It can cost to make gym memberships. Healthy food is perceived as costing more, but that's not always the case. Social environment's important. You know, I think if you want to make a change, it's very difficult if your partner's not supportive. And I was lucky that my partner was very supportive. But some families, it may be that you making a change makes others feel bad about themselves. And we have to be aware of that. There's so much conflicting knowledge that having knowledge gaps is inevitable. And of course, we're very rooted in being the way we are. So actually changing can be extremely difficult. But a few practical tips. Don't try to change unless you're sure you're ready for it and you have motivation. You understand why you want to do it. And be realistic. Now, SMART goals normally make me groan when I see that acronym, but actually it's true. It's there for a reason. And being realistic is very, very important. Confidence scales are important. I ask a patient, if they say they're going to do something, score it 1 to 10. If it's below 7, we need to change the goal. Readjust. Change one habit at a time, and wherever possible, try to work with others. There's certainly good evidence. If you work in an exercise class, as I do, you work 20% harder. It's probably the fear of being shown up, but you do work harder. And working in a group is very important. So, to summarise, firstly, with regard to the food pillar, I think everything's been said. I would just remember, try to think less of diet and more of healthy eating patterns. Exercise, I think doing something every day is important. Even on a rest day, light activity is helpful. Sleep, I think we need a constant routine if we want constant quality, and that means commitment at weekends as well. Prioritize your meaningful connections and think about stress management. I think that's really important for all of us. Now, I want to leave you with this quote from Confucius. It says, "A healthy man wants 1,000 things, a sick man only wants one." Now, that's true in itself. We all understand that. But what I would say is also reminds us there are 1,000 things, 1,000 good things we can grasp in life to do. And we need to do them, and we need to be doing them now. So when I've tried to make lifestyle changes, I'm not aiming for perfection. It's never going to happen. Nor am I hooked on the idea that I want to live to 90. I don't want to live to 90 if I'm miserable. I want to make sure that I'm enjoying life. I'm able to go on holidays, hobbies, spend time with people. So I would urge you to remember it's not just about getting healthy. It's about enjoying life and taking advantage of the myriad opportunities that life brings. So with that, I'll close and thank you very much for your attention. Thank you. I think we've got time for a few questions. I think so. No one's stopping me anyway. Does anybody have any questions, though? Johannes.
Thank you so much, Dr. Emad. It's a pleasure to watch you speak. I'm going to ask the same question that I asked Matt, because I'd like your take on it as a doctor. What do you think about melatonin supplements?
Well, it's very easy. I actually agree with Matt about melatonin. If you're genuinely melatonin deficient, that's one thing. Otherwise, taking it regularly isn't going to really be of great impact. It is useful in jet lag. And I think particularly if you're traveling to time zones where you're going to be wide awake, so from here it would be traveling east, then there is some advantage to using melatonin supplementation to try to adjust, because what it will do is try to trick your brain into believing that it's bedtime. So that is one instance where I would say for those who struggle with jet lag, and you know, I have patients who work in the airline industry, and how they deal with the time zones all the time, I don't know. Matt mentioned magnesium as well. I think that I think the jury's out on magnesium and sleep. Some people swear by it and say it really helps them. And if it works for them, it's great. The studies do show some benefit, but they showed, for example, in one study that you could fall asleep 17 minutes earlier by taking magnesium. But at the same time, that study still had people there who were taking more than an hour to fall to sleep. So I would argue, what's the real benefit? Magnesium citrate is a good way to get absorbed magnesium into your body quickly, but I think from a lifestyle physician perspective, I believe that we can get our magnesium from foods. You know, there are plenty in nuts, for example. And of course, dark chocolate is a good source of magnesium. It's also quite a good source of fiber. So it's an excuse to have 1 or 2 squares, not bars, of dark chocolate a day. But I hope that answers your question. Okay. Do we have any other questions? One over there. Oh, thank you very much.
Thank you very much. It was an interesting presentation.
Interesting's a loaded word.
Okay, my question is,
Sure.
You spoke about lifestyle changes.
Yeah.
How can you tell someone who is very stressed that stress is not there and you're just imagining this stress?
I don't think, well, you don't imagine stress. I mean, it is their reality. And their reality is they are stressed. Now, whether that stress is appropriate to their life is another matter altogether. But I think as a physician, I would first of all say, I wouldn't deny their stress. You don't deny their reality, you acknowledge it. Because I think if you empathize and you sympathize, you have more hope then of taking a more detailed history to find out why that person feels that way. And once you find out why that feels that way, you have a chance of getting to root cause. And it may be that their stress comes because of previous trauma. It may become because of work insecurity, all sorts of reasons. So I hope I've answered your question. But I think the first thing is acknowledgement that there is a genuine problem there. It would be wrong to do otherwise. That would be to belittle their experience. And I have no right to do that.
Well, that was an amazing answer.
Oh, thank you.
Thank you very much.
Okay, thank you. I'm not sure if there are any other questions. Oh, one over here. I'm hoping someone's going to tell me if we don't have time. We're fine. If Amandeep says it's okay, it's okay.
Hello? Sorry. My question was also in regards to stress.
Okay.
I understand that you said that sleep was our main pillar. You know, it's contributing to stress and the rest of our lifestyle changes as well. But at least in my experience, because of stress, you're not able to fall asleep. You're having trouble with that, which messes up the rest of your day and other healthy habits that you could be building. In your experience, what have you found to be very actionable changes, small changes, as you said, that have been successful? Or is it that it's different for each person?
Well, you've hit the nail on the head. It's very different for each person. I mean, sleep is not the only cause of stress. Obviously, we've got multiple causes of stress. And I think it's about taking a detailed history about the sleeping pattern if we're looking at sleep. If someone has really bad insomnia, then actually the gold standard therapy is cognitive behavioral therapy. So it's identifying what the real need is for that person. If someone has insomnia and has particular triggers that make them lie awake at night, I think sometimes, again, it's about acknowledging those. They may be worried about their financial position. They may be worried about their health or the health of others. These are the things we have to determine. But we also need to be aware that, you know, if it's work-related stress that is causing the sleep disturbance, the answer is to look at the work pattern in the first instance. So it may well be that somebody is having difficulties at work, and there are things like learning how to manage your time better, which sounds like a truism, but it works. If people can manage their time better at work, their stress levels fall, they feel more in control. So much of this is about psychology. I'm very fortunate in having a very good clinical psychologist in the centre where I work. So I quite often refer people who've got sleep problems to her because I know that the kind of therapies that she can offer, which are non-pharmacological, give control back to patients. I think a lot of this is about making people feel in control of their own well-being.
Fantastic. Thank you so much, Dr. Emad. I love the fact that this has been a super interactive and dynamic session. We love our audience answering these questions. And I think this shows, it's a testimony that I started by saying Dr. Emad was coming back to our stage with this particular session. It means he needs to come back again because we have burning questions. Dr. Emad, and just to reiterate that last final point you made, you said about giving power back to people.
Yeah.
Your information, your insight really empowers us all to learn from what you shared here, but also to go off and do our own learnings as well. Absolutely. So on that inspiring note, please, audience, give Dr. Emad George a big round of applause. Thank you so much.
Very much indeed. Thank you.
Fantastic.